Good morning, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we will talk about the types of the synovial joint. Fifth type is ellipsoid joint. In this, articular surface include an oval convex male surface fitting into an elliptical concave female surface. Free movements are permitted around both the axes. Flexion and extension around transverse axis and abduction and adduction around anterior posterior axis. And the combination of movement produced is known as circumduction. Typical rotation around the third vertical axis does not occur. Examples are wrist joint, metacarpophalangeal joint, atlanto-occipital joint. Next is saddle or sellar joint. In this, articular surfaces are reciprocally concavo-convex, and the movements are similar to those of ellipsoid joint, with addition to some rotation around third axis, that is vertical axis, and cannot occur independently. For example, first carpo-metacarpal joint, sternoclavicular joint, calcaneocuboid joint. The first metacarpophalangeal joint, that is joint between the trapezium and the first metacarpal, that is metacarpal bone of the joint, which is a type of the saddle joint. Sternoclavicular joint is also the example of the saddle joint, which is a joint between the sternum bone and the medial end of the clavicle. It is an example of the calcaneocuboid variety, which is also a saddle variety, that is reciprocal concavo-convex surface. Next is a ball and socket, that is vertical joint. In this, articular surface includes global head, that is male surface, fitting into a cup-shaped socket, that is in female surface. Movement occur around an indefinite around of axis, which have one common center. And ball and socket joints show flexion, extension, abduction, adduction, medial rotation, lateral rotation, and circumduction freely in all plane and axis. Example are shoulder joint, hip joint, talocalcaneo-navicular joint. This is the example of the ball and socket joint, that is in hip joint. It is the head of the femur and is the acetabulum of the pelvic bone. Thank you.